Hi, this is Doctor Philip Cordova with CORE Chiropractic. Today we're going to talk about sciatica. Now, sciatica is one of those problems that we see all the time. A lot of people think sciatica is any nerve pain going down your leg, but sciatica is a specific condition where your sciatic nerve, which runs like into your butt cheek, into your glute muscles, and then down the back of your leg, is hurting, sometimes associated with low back pain most often. But that pain continues to build and continues to shoot down the back of your leg until it becomes worse and worse. Sciatica is something that chiropractors, at least in our office, we see a lot of. Now, when we're treating sciatica, we're going to do a couple of things. So the sciatica, that nerve comes right out through here. It's going to travel down here and through the muscles down here, down the leg. So the first thing we're going to look for is any interferences along this entire pathway that would cause pressure. Any one of these interferences can cause pain and pressure all the way down that nerve. So whether it's that vertebrae itself has shifted out of alignment, or the disc is inflamed and swollen and causing pressure there, or this bone here, which is called your sacrum, has shifted out of place, or this part, your pelvis, has shifted backwards or forwards, or there's a fan of muscles right here called your hip rotator muscles that sciatic nerve goes right in between. Those can be tight. They can also be tight, causing this to go out of alignment, and there's no law that says you can only have one of these problems. So sometimes people have more than one of these areas misaligned, and that's what's causing the pain and the pressure. So when we see a patient with sciatica, we're going to go right to work. We're going to do an examination, we're going to take any necessary x-rays, and we're going to look for those spots. Very often there are more than one of those areas that are being affected, so we're going to adjust and check all those areas. We're going to do stretches, we're going to do things like electric stimulation, ice to control that swelling and that inflammation. If you happen to have a herniated disc, it does not necessarily mean that you are immediately a candidate for surgery. In fact, very often a couple of weeks of chiropractic care will prevent somebody from taking that next step, from getting injections or getting surgery, and we can see a lot of help with that. But sciatica are one of those conditions that have become more commonplace because we spend so much time sitting at a computer, which tightens up our hamstrings, which tightens up our hip rotators, and then we go try to exercise. So we go run on the weekends, or we're hitting the gym right after work, and we're not stretching. We're not stretching those hip rotator muscles out, we're not stretching our back, we're not moving our hips, and so we continue to have sciatic nerve pain and pop an ibuprofen like they're going out of style, and the problem is really a mechanical one. It's one that chiropractors have a lot of success in helping, and I hope you'll visit our office soon to find out if we can help you.